Thank you very much and good afternoon. I would like to start today's briefing by pausing to acknowledge and to remember and mourn the children whose remains were found at the former Kamloops Indian Residential School. I struggled to find words to express my horror and grief at the discovery of these remains of 215 First Nations children. I realize it's because there are no words that can do justice to those children and the countless others who died alone and scared, far from home, far from the families who loved them. There are no words that can make right a deliberate and intentional system that was designed to assimilate and extinguish Indigenous peoples. So today I don't offer words, but rather my renewed commitment to actions that arrest and disrupt our deeply rooted ideologies of settler supremacy. We must make no mistake that while these deaths happened in the past, our systems and laws continue to perpetuate racism and discrimination that hurts Indigenous peoples in countless ways. I've stood at this podium many times as an expert in public health, and today I'm here again as a humble learner in reconciliation and decolonization. I am so grateful to the First Nations and Métis leaders who continue to share their wisdom with me as I personally work to deepen my understanding of reconciliation and the ways in which I can work to advance it. This is hard work that requires us as leaders and settlers in our systems to find the courage to accept that this is our history of colonization. It's not something that happened to First Nations children and families. This is something we did to First Nations children and families. We are all implicated in this tragedy. In order to honor the strength and resilience of survivors and descendants of Indian residential schools and the memories of all those who never returned home, each and every one of us needs to ask ourselves, what meaningful actions can we take to uphold the rights of Indigenous peoples? I'm very grateful that I have a team that is committed to this, and we will be coming together once again, reflecting on the many paths that we have forward. The Truth and Reconciliation Commission calls to action. The Missing and Murdered Indigenous Women and Girls calls for justice. The In Plain Sight recommendations that we received earlier this year, and the Declaration on the Rights of Indigenous Peoples Act. And we will hold ourselves accountable to an ongoing process of reconciliation that we have tried to mirror through this pandemic. We cannot get stuck in our shame and grief, but rather commit to ourselves, to one another, and to First Nations, Métis, and Inuit peoples that we will deliberately and intentionally take actions that will serve to heal rather than harm from this day forward. And I'd also like to start our update today with transitioning as we are in our step one of our restart. We're going to start with the immunization progress as a positive way forward. As of this past weekend, we've delivered 3,250,116 doses of all 3 COVID-19 vaccines to adults and children here in British Columbia. And over this past weekend, we have immunized 3 million people. 3 million people of us here in BC. 179,954 people have received second doses. This equates to 69.7% of all adults 18 plus and 66.1% of those 12 and older in our province. Our vaccines, as we have come to know, are safe and highly effective, but they're not 100%, at least not yet. This is why it is incredibly important for us to make sure people get second doses, and over this weekend, over 300,000 people have now been either received or booked their second doses again. A second dose is necessary to maximize our protection and for the maximum amount of time. And this is very good news for all of us that we are on that road. We expect to receive more of both Moderna and the Pfizer vaccines in the coming weeks, and we will be moving out to communities as well to start the second dose. Later on this week, on Thursday, I will provide the details of our dose 2 approach for those who have received the AstraZeneca vaccine, and we have updates on information that so people can make the best decision for them around which vaccine they want to receive for their second dose. Going back to the other things that we are monitoring carefully, and that is cases, hospitalizations, ICU cases, and deaths. In the last 3 periods from Friday to Saturday, we had 258 new cases of COVID-19 in BC. From Saturday to Sunday, 238, and in the last 24 hours, an additional 212 new cases diagnosed. This brings our total to 708 new cases over the past weekend, and 144,289 people have been diagnosed with COVID-19 in BC. Of the new cases, 140 were people in the Vancouver Coastal Health Region, 394 people were in the Fraser Health Region, 18 in the Vancouver Island Health Region, 113 people in the Interior Health Region, 42 people in Northern Health, and 1 was a person who normally resides outside of Canada. We currently have 2,953 active cases across the province, 249 of whom are in hospital, 78 people in critical care or ICU, and 139,562 people have recovered from their acute infection. Sadly, we have had additional deaths as well from COVID-19. There were 11 new people who died from COVID-19 over this weekend, bringing the total number of people we've lost in British Columbia to 1,703. 1 was a person in their 40s, 2 were people in their 60s, 6 of these were people in their 70s, and 2 were people over age 80, reflecting again that our seniors and elders are those most affected most tragically. And our condolences and thoughts go to those who have lost loved ones. We know how challenging it is in this time. We've had new outbreaks over the weekend at Richmond Lions Manor in Bridgeport in Vancouver Coastal, and an outbreak was declared at the Iqra Islamic School in Fraser Health. The outbreak at Lions Gate Hospital is now declared over. This means we have now 6 active outbreaks, 5 in long-term care, 1 in assisted living, and 1 in acute care. I do also want to report that we've had an additional case of VIT, or the vaccine-induced thrombocytopenia, thrombolic thrombocytopenia. That brings our total to 3 cases now in British Columbia. This is a man in his 30s in the Island Health Region who is now receiving treatment and recovering in hospital. While we are making significant headway in our immunization efforts, and that is reflected in the decreasing case counts in our communities and in our hospitals, it is still a time of caution for all of us. New strains are circulating, and outbreaks are still occurring in schools, in hospitals, in long-term care, and in our communities. We are in the midst of the post-long weekend incubation period, which means anyone who may have contracted the virus at that period of time will be starting to see symptoms now. And it is important, if you have any symptoms, to get tested right away. Our testing sites are still up and running and active. You can get the support, so we can find people, we can support you to be isolated, to get the care that you need, and contain further spread. We have seen a few new outbreaks in these recent days, and we all need to take our precautions to prevent more. Using your layers of protection is something we have talked about for a very long time, and we all know they are just as important today as they were a month ago or 6 months ago. Immunizations are an extremely effective tool, and that is an important tool for us to get through this pandemic. But they are not fully protective, and they're not fully protective yet in our communities. That's why it's important we all stay vigilant so that we can prevent transmission and stop this pandemic. Registering with the Get Vaccinated immunization system is the fastest way to get both your first or your second dose, and particularly for anyone who is immunized prior to April 15th. Please go on the system and register. If you've already in there, the system will now tell you that. So there is no problem with registering more than once. And I've said this before, but it is important. We were building our registration system as we were delivering vaccine in the early parts of this immunization campaign. So anybody who received their vaccine prior to the middle of April, to April 15th, it's important for you to go and register on the Get Registered immunization site. We do have a record of your vaccination and your PHN, but what we don't have is that easy way to connect with you through text or phone. So if you're unsure, complete the 2-minute registration process, and this system will immediately notify you whether you are in there or not. And many of you who may not be aware of this will be receiving a letter from us in the next few days with the information you need as well. So it is with very mixed emotions that I stand here today. We are in the middle of step 1. Part of me, of course, is pleased that we are making progress. We've seen a dramatic decline in cases and great progress in our immunization program. But we need to continue to closely watch, and the active outbreaks and new cases make me concerned. And we, of course, are mourning for those we've lost for COVID, but also for the tragedy that we've seen unfold in our communities. We need to take this time of sadness to stand in solidarity, connect with our children, connect with our grandchildren and our families, and honor everyone we've lost in the past 15 months and in times past. Let's also take this time to learn about the tragedies of the residential schools so that we can move forward together. And let's remember more than ever when we're going through these trying times how important it is to be kind, to be calm, and to stay safe. Thank you.
Thank you very much, Dr. Henry, and I'd like to start today's briefing, as Dr. Henry did, by acknowledging the discovery of the remains of 215 children in Tecumlets Loops Te-Swetnik at a residential school, and the atrocity of residential schools in BC. We all, if we are human, I think, feel for the lives lost and their families and their communities, and the multi-generational trauma that continues today. And as Dr. Henry has said, must commit ourselves to action and not words, and to action with the direction and the leadership of Indigenous people in our province and in our country. I think we need to understand from a healthcare perspective that we need care that understands and supports those with trauma from residential schools. And we need to ensure our healthcare system understands and supports those with trauma-informed care, with knowledge of the history of colonization in the residential schools system and the destruction and displacement of communities. We need to act in this way. People will know that recently Dr. Mary-Ellen Turpel-Lafont led her own, on behalf of the government, an inquiry into racism against Indigenous-specific racism in our public health care system. And those actions, those recommendations are being acted upon in concert and in partnership with Indigenous leaders, and we will continue to act. And I just wanted to note for everyone is, as we move through that implementation, that anyone wishing to share their experiences of racism and discrimination in healthcare may do so. There's a toll-free number, 1-888-600-3078. And I also would like people who to know that there is a national residential school crisis line that has been set up to provide support from former residential school students and those affected. Access emotional and crisis referral services by calling the 24-hour National Crisis Line, which is 1-866-925-4419. With MBC, the CUAS Crisis Line Society provides First Nations and Indigenous-specific crisis line available 24 hours a day, 7 days a week, toll-free from anywhere in British Columbia. And that number can be reached toll-free at 1-800-588-8888. 8717. I'd like to start, as I normally do, by recognizing the 11 people who passed away related to COVID-19 in British Columbia this weekend. 7 from Friday to Saturday, 1 from Saturday to Sunday, 3 from Sunday to Monday. It is, of course, for them and their families and their communities and their caregivers, it continues to be a challenging time to grieve, even at this point in the pandemic, especially perhaps at this point in the pandemic. I want all of them to know that we're with them in their grieving and in their difficult moments today. With respect to the public healthcare system and surgeries in that system, you'll know, Dr. Henry's just reported that we've gone in the height of the third wave from 511 people in hospital with COVID-19 to 249, which is obviously a significant reduction, one of more than half, that we've gone from 183 people in critical care to 78 today. And that everyone in our healthcare system continues to work extraordinarily hard to support people who are dealing with COVID-19 and everyone else who needs acute and health care in our province. I would note that as of today, only 7 of our surge ICU beds is in operation today and is being used. A sign, I think, of the reduction in the demands on ICU related to COVID-19. However, this is a very significant and busy time for our healthcare system, and there are, in fact, more people in hospital with other conditions today than there was a few weeks ago. As we've noted, 3,250,161 doses of COVID-19 administered, 3,064,568 first doses. That's 69.7% of all adults in BC. That's 66.1% of all those eligible, meaning all those 12 and above. That's 87% of people over 70, 84% over 60, 81% over 50, 78% over 40, and 74% over 30. I'd also note that more than half of those between 12 and 17 have registered for their first dose immunization. That's 168,899. And that 3,185,217 registrations have gone through in British Columbia. I'd also note that after the announcement by Dr. Henry last week of the sending out of booking invitations for dose 2 to many people in BC, that just under 450,000 booking invitations were sent out. And as of today at 8 a.m., 381,077 bookings had been completed, either online or through our call centers. And we encourage people, of course, to respond when we ask them to book and to continue to register. And this is an important theme, that we continue to meet the test of vaccination, and that means continuing to increase our level of registration and immunization in every part of the province. I want to acknowledge all the work going on across the province by people in our immunization campaigns, from big communities to small communities. In Rutland this past week, we had a pop-up clinic that was successful, immunizing about 250 people in a short period of time, and we are looking at those kind of decisions strategically to address areas where we had not previously had a high level of immunization, and to increase it in the coming weeks, and public health is working hard on that. I think out in our neighborhoods this weekend, I know it was true in Renfrew, Collingwood when I was, it was pretty clear for most that it was a different sort of weekend than we've had in a long time. A weight had been lifted and a pressure eased. It was, I think, a restorative weekend for many. I want people, though, to know, and it's clear that while the circuit breaker may have ended, our cautious behavior is still very much with us and needs to continue to be. And that encouraging, as BC's Restart launched last week is, and the fact that now 69.7% of adults and 66.1% of those over 12 have received their first shot, as encouraging as all is, we have to continue to follow public health guidance and public health orders, that even though the number of cases is down, being cautious in our action and getting our shots will make next weekend even better, and the weekends after that even better and more restorative. It is within our power, but the key is, again, to be respectful of one another, to be kind to one another, as Dr. Henry says, and to register, and when you're invited, book, and get vaccinated now. There will be opportunities for first doses and, of course, for many now for second doses in BC. It is critically important that we all take advantage of those opportunities and continue to increase our level of immunization.